Hi, my name is Andrew and I'm going to be going over the interdisciplinary initial assessment. This is a tool that we will use when a patient is admitted to the hospital for the first time during their admission stay. The initial assessment will be located on your work list when the patient is admitted and entered into our computer system. It is an automatically generated or populated field that you will find in the work list to document. Usually it's going to be found at the top of your screen as one of the newest items on your work list. In this situation, the initial assessment is here up top. So I'm going to go ahead and click on that once or press OK, or I can also double click on that item to open that field. When you read the transaction line down below, it's going to ask me to choose an option of what I want to do. I want to document on the initial assessment, so I'm going to click Document, and it's going to ask me enter the date and time. Now usually when a patient comes to the hospital and is admitted in their room, we will do our assessment and then go back and chart in the computer system. It's asking me if I did this assessment now. What we're going to say today is the patient came in at it's now 10:40, and we're going to say the patient came at 10:10 and the initial assessment was done at 10:10. So I'm going to change this time to 10:10. And I'm going to select OK. Now we're going to go ahead and get started with the documentation portion. The first question it asks us is chief complaint, and we're going to say the patient came in with abdominal pain. You'll notice that in this first section it's bolded. Anything that is bolded, which are numbers 1, 2, 3, 4, and 6, must be documented to the computer system. Anything that is not bolded, we recommend that you document those items, but are not mandated. We're going to go ahead and press OK that we did the chief complaint. The next one is going to ask us the present illness history. We're going to go ahead and document that by pressing D. And we're going to say the onset was 3 days ago. And press Enter. The description, we're going to say aching pain. And this is all what the patient has told us during our admission. Press OK. OK, one more time to get to the next screen. The next screen is asking us what is the illness disease history. If there was a history of the patient of the past of the disease or a past medical history, we would click on D for document, or we can bypass that if they didn't have any history and click on no past illness disease history, which I'll do now. The next question is asking us about the surgical history. If the patient did have surgical history, you would click on the D for document, or N, or click here, no past surgical history, which is what we're going to do. And same for the next question, any injury history. We're going to say that there was none, so we're going to document no prior injury history. The next question is asking if there are core measures for this patient. The patient came in with abdominal pain. It does not meet any criteria for these core measures, so we're going to go ahead and select none. If the patient did come in with a core measure such as pneumonia, we would select the pneumonia category. When you are documenting, we are recommending that you fill out these next few lines here that are non-bolded to obtain better history of the patient. However, for training purposes, we're going to go ahead and bypass this. And you'll notice that our assessment screen options, number 1, the past medical history, there is nothing here that is it is blank. It does not say no data or incomplete. As we complete each of these sections, this no data incomplete section will disappear. I'm going to go ahead and document the rest of the assessments and show you how easy it is to document. The next section is the health history. We're going to click on there. We're going to assume that the patient has no health history and the only thing the patient takes at home is aspirin. The first section that says home medication, so we're going to go ahead and click on there. And our next section says select medications to edit or choose an option. And we're going to click on the add because we want to add that aspirin the patient takes. It says at the bottom enter partial medication name, so I'm going to put aspirin. And I'm only going to spell it halfway. I'm going to put that dash, which is also known as that wildcard, and press OK. And it's going to find everything associated with the word ASPI, which is what I typed. I'm going to click on that aspirin number 1, press OK. And we're going to say that the patient takes that chewable tablet 81 milligrams daily. So we're going to go ahead and click on that number 1, press OK. And the daily is number 7 every day. And it is formulated as aspirin oral tablet 81 milligram, or dispensed that way, so we're going to choose that one. If there's any other documentation you need to fill out here, the patient instructions, reason, ordered by, last date taken, you can fill out. I'm going to bypass this just for the training purposes, so we can move forward. And you'll notice that my aspirin pulled up here on the health history portion of my home medications. If the patient did have more home medications, this is the time where you would click the Add category on the bottom of the screen and add the other medications here. We're going to assume the patient is only taking the aspirin, and that's all we're going to document for that. The next is the latex precautions. We're going to click on that field, and it asks us if the patient has latex precautions. We're going to say no. Advanced directives, we're going to say unable to determine. Substance abuse, we're going to say the patient does not abuse any substances, so we'll say none. Same thing with tobacco, we're going to say that he never smoked, which would be number 4. Any drugs, we're going to say never used. Select OK. Influenza season, if it is influenza season, we are required to document if the patient was immunized or not. However, it is not influenza season, so we're going to say no. Pneumococcal screening, we're going to go ahead and click on that. And we're going to say that the patient was immunized at the age less than, we're going to say age is 65 and above immunized prior to admission. Okay, because the patient is 92 years old. And we are assuming that he was immunized based on his assessment or asking him. The date, we can say the patient was immunized last year, which would make it 2013. And press OK. And our health history portion is completed. We'll press OK again. And you notice that fell off the screen too. So the patient came in with abdominal pain. Everything else is okay on the patient according to my assessment. So I'm going to show you how fast and easy we can document that. So we're going to go to the neuro assessment, and it says number 1 in bolded, within normal limits. And the patient is within normal limits, so I'm going to press no exceptions. If I press OK, it goes down through the whole thing and it's filling out that everything is okay for me. I'll press OK, and that fell off on my list. ENT assessment, based on my assessment, he was perfectly fine. I'm going to click on number 1. Click no exceptions. Everything is automatically populated. There's no problem with the patient, with the ENT. I'll press OK. We'll go to cardiovascular and do the same thing. It's asking me if the patient has a pacemaker. We're going to say no. Respiratory assessment. We're going to say that he's perfectly fine there. No exceptions. Oxygen therapy, that he's on room air. Get down to the GI-GU assessment. Okay, and we're going to say that he's complaining about that abdominal pain. So we're going to say abdominal characteristics. Okay, abdominal character, we're going to click on that. You'll notice that because I selected a problem with that abdominal characteristic, it left the abdominal character open, so I need to document there. We're going to say that his abdomen is firm, distended, okay, and his bowel sounds are absent to all quadrants. Okay. Last bowel movement, this is when what we would ask the patient, and we can click on number 1 as the date, and specifically we're hypothetically going to say that the patient told me that his last bowel movement was 4 days ago, so I'm going to put 03. 4 days ago from the 29th, which is today's current date down here on the bottom right of the screen, is the 25th, so I'm going to just type in 25. And we are in, according to the bottom of the screen, 2013, so I'll just put 13. I'll press OK, and the date automatically populates. I'll press OK now to go to the next screen. You'll notice that it turned a bold color. That means that there was a problem associated with that. Anything that I documented in the respiratory, cardiovascular, ENT, neuro assessment is not bolded, hence because there was no problem associated with that. I did say that there was something wrong with that abdominal characteristic, that's why it is bolded. So we're going to go ahead and document through the rest of this portion of the admission, and I'll show you that since there's nothing wrong with the musculoskeletal, nutrition, function, fall, pain, and so forth. Pain is we will document that there's something wrong. But everything else will be okay, so I'll show you how that goes. Click on musculoskeletal assessment. We're going to say there's nothing wrong, so we select no exceptions. If there was something wrong, this is the category where you would select something. Same thing with the nutritional screening. Home diet, we're going to say he eats regular food. Newly diagnosed diabetes, we're going to say no. Renal failure, no. Weight loss, no. Reduced intake, no. Chewing difficulty, no. Diarrhea, no. Nausea, vomiting, no. Tube feeding, no. Is the patient on TPN? We're going to say no. Are there any wounds? No. We're going to click on functional assessment now. Is there any acute changes? We're going to say no acute. It's all populated for me. I scroll down. Any problems with swallowing? We're going to say no. Speech? No. And we're at fall risk. So we're going to click on the bold part, number 2. We're going to say that there's no exclusions. Any fall history, we're going to say no. Does he have any problems with elimination? Pick the correct category, we're going to say no problems. Medications, we're going to say he is on one medication, which is that aspirin. If that is labeled as a fall risk drug, you can select that. It is a blood thinner, so we're going to label it as a high fall risk drug. Usually high fall risk drugs would be like blood pressure medications, narcotics, and so forth. The equipment, we're going to say he doesn't use any equipment. Mobility, we're going to say he does not have any risk factors. And the cognition, we're going to say that he's perfectly fine. So what we're doing here, the whole goal here is we're giving him our patient points in relation to assessing him for his fall risk. The more problems that the patient has, the higher points the patient will obtain. The higher points the patient has, the more chance they are, or at risk they are for falls. We're going to do the pain assessment. We're going to say that the patient is having pain and is complaining of that abdominal pain, hence his admission. We're going to say the tolerable pain level is a 2. His pain on the pain scale, numeric, we're going to say that his pain level right now is a 5. In his abdomen, it's acute. And is the pain level acceptable to the patient? We're going to say no. We're going to say that we provide education and make sure that education is provided either verbally, a printed handout from an appropriate website like Crames or Mosby's. Press on OK. And we're almost done with our admission assessment. We're going to go down to the psychosocial section. We're going to state their beliefs for their cultural. Any spiritual beliefs, we'll say none. Cultural beliefs, none. And so forth. Their mood, attitude, appropriate. Risk for suicide, we're going to say no. Do they have a plan? No. Hallucinating? No. Previous attempt? No. Chronic illness? No. Life-changing event? No. Depression? No. Okay. Violence or abuse? The patient feels safe? Yes. Do they feel threatened? No. And so forth. Throughout this admission process, you will document the whole entire admission. Be sure that at the end you do accept. When you accept, it is saved in the system. Thank you.